As in studio, I still have Dr. Njoroge Ngaruya from the University of Nairobi. We're discussing the cholera incidences in the country. So far, 92 police officers are in different hospitals across the city as they recover from a cholera outbreak about 2 days ago. Now, Doctor, just believe it was this month, we had the World Health Organization, which had a new position paper on curbing cholera, especially in Kenya and Somalia, which has also witnessed several incidences. And what they outlined was an integrated integrated approach to prevent this disease, because we have clean water and sanitation being one of the main issues when it comes to cholera. But what about vaccines in areas which are prone to cholera outbreaks? We have internally displaced camps. We have informal settlement areas. What are your thoughts with regard to this approach, and perhaps your thoughts on the approach or Kenya's reaction to the last 3 incidences that have been reported?
One again is to thank our government for the primary approaches they take. Yes, we have challenges, but we are headed somewhere. One, after the first outbreak of the disease, one thing that for you to move from the infection stage to now preventing the disease, you need to acknowledge that the disease is there. We've seen our government come out and say it's true, we have the disease here, and we've seen they came up with a task force. Then WHO came in, they brought in kits, and it's good to note that one kit is able to cover 100 outbreaks. For the prevention of these outbreaks, we've seen our government try to create awareness. We've seen the Ministry of Health or close down some hotels, and to add to it, maybe something more can be done. And what more can be done is that the prevention of this disease should be interministerial. We should have the Ministry of Water, we should have the Ministry of Health, we should have the Ministry of Education. The Ministry of Education should come in, and students in high schools, pupils in primary schools, that is where the education starts. And those are the easiest people to reach out to. You educate them on washing hands, you educate them on how to boil their water, how to store their water, and they replicate this in their homes. So maybe to add to it is that our government has done something, but then we have room for more improvement. And if an approach, maybe interministerial approach, can be taken, then these incidences and these outbreaks can be reduced.
Right.
Yes.
What is the assessment of, from a medical standpoint, of the situation as it is within Nairobi County? Because 90 police officers in hospital is a rather large number. Yes. The first time, I believe it was about 40 people that had been affected by that cholera outbreak. So that means the entire Nairobi County really is at risk. What is the state of this disease as we speak?
To note is that, as I said at the beginning, what we have in now is an endemic case. An endemic case basically is a national disaster. It's up to the ministries involved and our government to come out and open and say what we have in now maybe is beyond our control. We can take control of it, and these are the steps that we want to. These are the steps we need to take as a nation, as a government. But as it is now, having police officers in an institution being affected, then it shows something somewhere is not working well.
All right,
Yes.
And you've mentioned the kids, but in terms of capacity, are doctors able to contain the situation, considering the nurses' strike still continues? They were given a decision on order by the court, rather, to go back within 7 days, but they say they will not go back. So it means the country will go without nurses for quite a while. A cholera outbreak is no easy thing to deal with without nurses.
Yeah, it's good to note that again we have a few centers, cholera control centers set up. We have some in Kenyatta, we have one in Mama Lucy Kibaki Hospital, we also have one in Bagathi. But again, these centers, we have input from international NGOs, we have WHO, we have MSF, we have inputs from CDC. The situation as it is now, we yet to get to that point where we can say the situation is out of control. We have Kenyatta National Hospital nurses are working. The NGOs that come in, I'm sure a case example is Mama Lucy Kibaki Hospital. I've seen they bring in their nurses. So it's important to note that we need the nurses to work, but for this specific disease, we yet to say that we're out of control, but we need our nurses back to work very urgently.
All right.
Yes.
And of course, what we need, as a country is long-term solutions
Yes.
to this issue. What would you suggest are some of the solutions long-term to deal with this problem?
Long-term solutions, basically, the primary thing is to have the healthcare provider conversant with when to detect this disease, how to detect it, how to treat it. So primary education to our healthcare givers is very important. Then two is our population education, and as I said prior, is that we need to bring in the Ministry of Education to start these the prevention measures from primary schools all the way to our tertiary institutions. Then three, we need to have financial input into the prevention of these diseases. We need to see proper sanitation, we need to see our towns clean, we need to see tapped water in our homes, we need to see food handlers re-examined and re-evaluated by medical practitioners. Because again, it's important to note that somebody in your kitchen can be the person transmitting that disease to you.
Right.
If your house help doesn't wash his hands and he ends up contaminating your food, then the whole household, maybe you 3 of you or 4, gets infected. So that re-examination and re-evaluation of our food handlers is very important. Then 4, to sum it up, what is important is for everyone to join hands and to be aware that the disease is prevalent with us. Yes.
All right. Thank you so much for speaking to us, Dr. Njoroge Ngaruya from the University of Nairobi. A conversation there on the cholera outbreak in the country. Dr. Ngaruya saying is bordering a national disaster, one that needs to be addressed accordingly. This is Your Health on Morning.